Hi, this is Steve Worona, and you're listening to Campus Public Safety Online from the National Center for Campus Public Safety. Before I introduce today's webinar, here's a brief orientation to the Adobe Connect interface we're using. Your browser right now is showing the title slide for today's talk. On the left side of your screen, you'll see a box labeled Questions and Comments where you can read and type messages. And there's a tab labeled Everyone at the bottom of this box, and that's the tab you'll use for all of your general messages, including questions and comments for our speaker. We'll be breaking for discussion several times during the presentation, so please do not hold your questions to the end. You can also send direct messages to a specific person by hovering your cursor over a name in the attendee list. And one of those names is Technical Help, and that's the place to go if you run into technical problems. We're also monitoring Twitter for your questions and comments. Use hashtag NCCPSwebinar. If you missed part of today's conversation, or if you want to see some or all of it again, this webinar is being recorded and captioned. The link will be available on the NCCPS webinars page in about a week. And watch your email for a link to a brief evaluation survey requesting your reactions and comments on today's session. Please take a minute to respond to that survey when the link arrives. We do appreciate your feedback. And now for today's presentation. Our topic is reunification planning, a multi-level, multi-discipline process. Several years ago, Arizona State University hosted a statewide exercise in which they, quote-unquote, collapsed part of their stadium while occupied. The focus was responding to a catastrophic event, but one of the major issues that arose from the exercise was reunification. ASU found that there was very little existing information to guide them. Today we're going to hear about the comprehensive plans ASU developed to address critical points of the reunification process, a model designed to be easily transferable to any incident command structure. Our speaker is Alan Clark, Executive Director of Preparedness and Security Initiatives at Arizona State. Alan's public safety career has spanned more than 25 years, starting at ASU in 1989 as a police officer and rising through the ranks to become Assistant Chief of Police. In 2012, he became ASU's emergency manager and assumed the executive director position in 2017. In this role, his emergency management efforts continued and his areas of responsibility increased to include additional security topics such as door access, cameras, and a variety of other initiatives such as planning security operations for Super Bowls and for dignitary visits, including the ASU 2009 commencement with President Barack Obama. Prior to his tenure at ASU, Alan worked as an officer in Huachuca City, Arizona, and as a law enforcement specialist and security forces officer for the Arizona Air National Guard. He holds a Bachelor of Science in Supervision of Law Enforcement from Ottawa University. Alan Clark, welcome to Campus Public Safety Online.
Well, thank you, Steve. And I'm very impressed that you were able to say Huachuca City. Not many people get that. So thank you very much. And folks, it's a pleasure to be here. Good morning to those of you who are in my time zone, and good afternoon to others. So what we're going to talk about today, as stated, is reunification, the next step. And what I mean by the next step is this. So after the initial response is what I'm going to really focus on. So we know that response to the scene is chaotic, and first responders are going to have that to bear and at hand. But it's what do we do after that? How do we start addressing the needs of the family, the needs of the community, and those kind of things? So as you can see, the three things that we're going to address today are assumptions related to reunification, activation of the reunification process, and the three-prong approach. How do we plug and play into the incident command structure? So before I dive deep into anything, naturally we have some disclaimers and credits that I want to give. Arizona, we had an exercise years ago, and we didn't find a whole lot of information out there on reunification, what we were looking for as far as reunification. We went to others, King County, and Los Angeles, who provided some guiding documents to us. So I want to give a shout out to them. The other thing, as far as a disclaimer goes, for those of you who are in first response or emergency management, if I told you that everything we did was going to be absolutely perfect, I would lose my audience at this point, because that is not the case. We can plan, we can put plans into place, and not everything's going to be perfect. So just know that a lot of what I'm going to talk about today is not everything is black and white. Some of it's gray in nature, and some of you are going to have questions. You're going to go, but wait a minute, I don't agree with that, or I don't necessarily know what he's saying there, but that's okay. Again, some of it's gray, and we'll be able to help with those questions. ASU, for those of you who know who we are, you know that we're a very large, complex educational institution, but the one disclaimer that I want to make here, or thing that I want to state here, is the fact that no matter how big you are, no matter how many resources you have to participate, you have to partner, and you have to build those relationships. If you don't, you will have a lot of problems, and when the event happens, you actually may not have the resources at bear that you need, so you're going to need to engage those partners. For example, early on, we engaged a partnership on counseling services for our reunification process, which I'll talk about a little bit later. And then as we kind of dove into that, we realized that those counseling resources that we were calling to bear from the city of Tempe, which surrounds our Tempe campus, would actually be used in the city, because most likely the city would be impacted by the event as well. So we were kind of dual tasking those counselors, so we had to build other partnerships and relationships. Finally, as far as the disclaimers go, you'll hear me talk about a system called EM-Track as we work through our presentation. And EM-Track is actually a product of a Javari system, and you'll hear me explain more about that as we continue. So, where do I reside? Where do I call home? Currently, Arizona State University. For those of you who know anything about us, we're a large research institution. We have approximately, over 100,000 student, faculty, staff, to include online students. I have 5 residential campuses. I house anywhere from 16 to 20,000 people on total across our campuses. And today what I'm really going to focus on is 4 of those residential campuses. The 5th one being in Lake Havasu, Arizona, which for those of you who are familiar with Arizona is several hours away from the Phoenix metro area. And that is really managed by Lake Havasu first responders, Lake Havasu emergency management. So we don't have a whole lot of play up there. It's a very small campus, though it is residential. We don't have a whole lot of play up there. So I'm going to focus on what is congruent or within our Phoenix metro footprint really as we talk today. ASU has its own police department. It's approximately 90 sworn officers, total staff of about 160. So when we talk about law enforcement services, that works well for us. However, we do not have our own fire department. We have 3 jurisdictions that reside as our first response fire departments. My West campus out in West Phoenix and my downtown campus in Central Phoenix, they have the Phoenix Fire Department. My Tempe campus, which is my largest campus, resides in the middle of Tempe, so Tempe Fire is my first responder, and my Mesa campus is responded to by the Mesa Fire Department. As we start talking about this reunification process, you're going to hear me talk heavily about use of our recreation complexes. Each of the campuses that we have, the 4 residential campuses I just mentioned, have a recreation complex on each of them. And so when we started this dive into where could we start this reunification process, and we started looking at locations, we said we could use our recreation complexes because we could train the recreation staff. The complexes are similar enough that those staff could move locations and be utilized in each location as needed. But this was extremely important to us from an emergency preparedness perspective, as you all know, related to redundancies. So you have to have redundant processes, you have to have redundant locations, because you have to bet that the first one's not going to work or it's going to be impacted somehow. And so when did we know that we had a problem, and why did we address this? As I spoke about a few minutes ago, we had an exercise years ago. We had about 1,000 role players on the ground. We collapsed a portion of Sun Devil Stadium, and we had lots and lots and lots of very good lessons learned out of that. But one of the things we didn't know what to do with after that is how are we going to reunify? And when you talk about Sun Devil Stadium, you realize that you have students in the stadium, but you also have family members that are not affiliated with your university in the stadium. And so how are we going to reunify all of those people? And that became a huge issue for us. So as we move to assumptions, again, these are assumptions. There's others. We can just say that there will be other assumptions that you may have. We know that families are going to show up. We know that information gathering or information, what people are looking for, may collapse our infrastructure. So for example, we've all heard of our 911 systems going down. We've all heard of our web pages collapsing. And though we try to be robust in those, it may or may not always work. This is a national statistic as we were building our manuals that was acquired through Coyote Collaborative, and that's that 8 to 10 people will show up per patient at a hospital. And those people may also show up at your reunification site. So your site needs to be fairly large and robust that you can handle, depending on how many people you have that you're looking for or trying to reunify. You need to have a site that manages that. I think it's obvious to say that people are going to be stressed and aggressive. They're going to want to be helped, and they're going to have high expectations on how we help them. For those of you who live in our higher ed communities, you know that we can't hardly have anything happen on our campuses without getting phone calls from parents and loved ones. So magnify that times whatever multiplier you want, and you will know that that's going to be a true assumption. Though we may not be able to meet all of their needs, and that's going to be true, we're going to try to meet as many needs as we possibly can. And as I get into the reunification process and how we've set up our center, you'll see how we're trying to address those. Ethnic and cultural traditions will be important, as we know that there are many traditions out there related to the injured, related to the dead, and those kind of things, and we have to be cognizant and understand those and be aware of those. And finally, victim identification, we know will be it will take a while. We have to do DNA testing in some states, or that may be a national standard. We have to work with your office of medical examiner, so it's not going to be immediate, and we have to know that. Unsolicited volunteers will show up. When they show up, we have to have the ability to process them. This next one is interesting, that when you have a chaotic situation, people get attracted to that, and I know it's hard to face, but pedophiles, others may show up and try to take advantage of our vulnerable children populations as we're dealing with a very chaotic scene. Your staff, the most important people we have are our staff, and we have to take care of those people. And oftentimes they aren't prepared. They may not be prepared to deal with this. We can train them, but the reality is we will have to help them as we walk through this process. Rest, nutrition support will be needed, and that staff support, meaning counseling and medical unit, falls under logistics section, and we'll show you that. So with that, Steve, I think we're going to break to the first set of questions.
Thanks, Alan. Yes, we are listening to Alan Clark. We're talking about reunification planning. If you have questions or comments for Alan during the presentation, type them into the chat pod on the left side of your screen. Use the Everyone tab, and we will pass them on to Alan during the breaks that we have planned. What about sensitivities about families who will not be reunited? So can you say something about that?
Yeah, absolutely. Well, we hope to reunite as many people as we possibly can. We know that in the collapse of the World Trade Centers, there are families that have not been reunited. We know that. So the sensitivities around it are such that we will bring to bear every resource that we can possibly bring to bear to try to make that reunification, even if that reunification is with a deceased loved one or family member. And in those situations where there's not per se a body or body parts, not to get gruesome, available, that we would also bring to bear all the resources which unfortunately we have across the country to help people to deal with that as well.
Jenny Janik wonders, could you speak more to the traditions and cultural variables to consider for the wounded or deceased in mass casualty situations?
Yeah, certainly. So without getting into specifics, and I'll try to, that's not my area of expertise here by any means, but bottom line is there's religious ceremonies involving the dead, for example, that are very important to family members, so deceased family members, the way the body is handled, the way the body is taken care of, the way the body is processed. Those are all very important traditions and cultures to certain religions, to certain ethnic groups, and that's what we have to try to assist those people and those families the best way we can. Are we going to get it right all of the time? I doubt. However, when we know what those family wishes are, we will make every opportunity that we can to abide to those wishes in the best possible way we can.
Questions are starting to roll in. We're not going to lose them, but I'm going to squeeze in one more during this break. Christy wonders, I am charged with writing a family reunification plan for our university. We have a good start to it, but how much teeth should we put into it? How in-depth should it be?
Well, Christy, when I work through my the remainder of my process here, you're going to see the breadth at which we put or the amount of information we put into ours, and that will probably help answer that question. I believe that we have written a guidebook, as you'll see later, all the way down to checklist because we believe it's very important. Again, will those checklists be followed to the T in an incident like this? Likely not, but at least it gives a very good guideline and a place to start during the confusion as to how we can at least get the process initiated and then get into what we call a battle rhythm in emergency preparedness or first response.
Thanks, Alan. As I say, we are not going to lose any of the questions that have come in. We've got another break planned in a few minutes, but in the meantime, Alan, we'll let you get back to your presentation.
Okay. So the next thing I'm going to talk about is activation of the system. Again, this is, so at Arizona State, we view the reunification process is, it can happen during, it's going to be towards the end of the response phase. It's not going to be immediate. Even for a football game where we have these plans in place, drafted, ready to go, it's going to take a little while to get this process started. So we'll talk about that, and we'll talk about how we move forward. So the reason we want to activate the reunification process, though, let's talk about reasoning behind it, is to share information with loved ones. I think we've all heard war stories or horror stories about families weren't communicated with. What we hope to do through our reunification process is we start bringing people to an assembly point, that being our fitness complexes at this point, is we want to find out what the needs of the families are, the needs of the loved ones, and we want to be able to start sharing valuable information with them as soon as we can. Now, the better we get at sharing single or individual messages to all, with everybody having input, is the way we want to do that if we possibly can. Gives us a way to bring loved ones to a location so that we can help them start trying to find family members, separated family members in the hospital, so on and so forth. And we can also provide emotional support to the families and victims, which we'll talk about in the three-prong approach here a little bit later. Naturally, any major incident, and folks, some of this is not necessarily aha, as you know, but any family or major incident that we're going to have, we're going to have the media that's going to show up. We're going to have curiosity seekers, and part of our job here is to work with our law enforcement partners to secure our complexes during an incident like this. We would secure our complexes. We would work with our public information officers to establish media sites where they could go to, and we would publicize those. But really, we don't want to let media into our reunification sites. We would try to keep them as far as we could within reason, because we want the families to be able to show up and get that help without being in the view of cameras as much as we possibly can. We want to provide child care in a safe zone for unaccompanied minors. Again, in thinking through and why are we using our student rec complexes is because our student rec complexes, they all have summer programming, and all of that summer programming, they all have to be background checked, and they have programs and games and activities for children. So if we're dealing with children in this type of environment, if you take the stadium collapse, for example, we know we'll have children that are separated that we need to move somewhere in order to get them reunified. We have the staff that know how to deal with or how to occupy a child's time and work with them. You're going to see here in a few minutes as we go through the different branches how we have postmortem considerations made as part of our three-prong approach. So we'll address that here a little bit further. The other thing that we do as part of our reunification process, and as you will see in our three-prong approach here in a few minutes, is we want a way to help families gather information about loved ones that may have been taken to hospitals. Now, mind you, there is a break in the system, and we know that. Take Las Vegas, for example. A majority of the people that went to the hospital in Vegas, or a large number that went to the hospital in Vegas, were driven by law enforcement, by friends, by families, by people that they didn't even know. So really, again, though we have a lot of answers and we have a lot of answers for questions, we don't have it all figured out at this point. We can track patients as they move through our 911 system, but what about those patients who arrive there that either ran or driven by somebody or self-dispatched, what we call self-dispatch to the hospital? So this activation helps us to help families try to identify the locations those loved ones may be at. And again, I'll get into how that process works here in a little bit further in a few minutes. And again, you're going to see that through our structure, we try to meet the needs of social, spiritual, medical needs, and that is part of our hospital reunification program, part of that three-prong approach. So let's talk about the big area or big elephant in the room here, and that would be when do we activate? Okay. Sorry about that. I got behind a little bit on my slides. When do we activate? Activation triggers. Well, naturally, we know that those are going to be different for X number of communities. I don't think anybody's going to handle those the same because we all have different political considerations. So, for example, some obvious activations, I've talked about the World Trade Center. I've talked about the Las Vegas shooting. I've talked about the Pulse nightclub, or I'm talking about the Pulse nightclub. Those may be some obvious activations to where we say, yes, we want to set up a reunification process to help loved ones find others. or help friends and families find others. But what if they aren't that obvious? What if you're a small jurisdiction or even a large jurisdiction and you have a bus load of athletes that overturns, and now we're dealing with those. So there are no specifics to when to activate. It's really going to be driven by your jurisdiction and by what your political needs are, political considerations and operational needs are. So other requirements. So as we started down this reunification process, one of the first things that attorneys especially will talk to you about are HIPAA requirements, and you can't violate HIPAA and those kind of things. And so what we started to address as we started talking about, look, can we have access to medical information sites? You heard me talk about EMTrack a little bit earlier. And one of the things that we had to address was, how can we get access to a medical site if we're non-clinicians, if we're not medical personnel, without violating HIPAA? And so I brought a whole slew of attorneys into the room, and they said, okay, well, if you could build within EMTrack, if you could build some screens or templates, for lack of a better term, that had identifying marks, scars, marks, tattoos, name, date of birth, non-HIPAA related items, then we wouldn't have a problem with you looking into those. You just can't see the HIPAA protected information. And so Arizona Department of Health Services was very helpful in helping us build those along with the owner of the system and building those pages. The other thing that the attorney said was, it would be nice if you could have any type of clinician that is licensed, so a counselor or anything like that, if you could train them to look at this site as you're trying to locate these loved ones, that would help us. We would be more comfortable if they at least had some sort of a formal credential. And then the last thing that they talked about was a declaration. They said, look, even if it's a local declaration, that we would be more comfortable if locally you declared that this is a major incident. It doesn't have to rise all the way to the state declaration, the county, the state, or the federal declaration, but at least you could declare locally that this is a major incident, and that would also calm their nerves here a little bit. So we have put in place processes to do that and plans to do that. Our counselors are the ones who would look at these systems and so on and so forth during this situation. So the takeaways that I would like you to take from really these three slides are a few things. Well, the key takeaway is redundancy. As you activate, what are your redundant systems? What have you put in place as far as working with others, is working with your staff, as far as site planning, communication, staff requirements, et cetera. And that's really a key to this activation process. Not only are you going to activate, but where are you going to activate, how are you going to activate, and having those systems and backup systems. So, Steve, back to you for questions.
Thanks, Alan. You've touched on this, but there's a lot of interest out there, so I'm going to give you a chance to say more. Mike Willison and Jacob Diaz are both wondering about tracking people. Mike talks about tracking where victims are transported, presumably among several different hospitals. Jacob wonders about students who may be located at other campuses, especially in a multi-campus system. So what types of mechanisms are there? Are there software programs? What do you do to track all of these people who may be all over the place?
Yeah, absolutely. And again, the answer to that is good luck, to be very honest with you, but I will address it. The bottom line is when we stand up, and I haven't touched on this because, again, this is part of that first response perspective, is standing up a command post, standing up emergency operations centers, and I'm not diving deep into that for the sake of time. But that command post, you would want to have those medical representatives, and they're going to have, so the Phoenix Fire Department and through the alarm room, they have tracking systems that the fire departments use, and you'll want to have those fire personnel represented in your command post so that you can, as part of your ops section or wherever you possibly have them, so that you can then defer to them and go, look, from the field, what patients have you taken, where did you take them, or were they diverted? That's a good place to start. Then as I get into the reunification process here in a few minutes, we'll talk about how the hospitals can help with that process and entering data into the system. And that will lead me into some of the hurdles that we faced here in Arizona as well. As far as the people that are self-dispatched, we may not have a tracking tool for them naturally, and that's going to be up to then the part of the hospital reunification plan where we ask the hospital to enter that data into EMTrack, the system that we use, so that when we query that system, hopefully we can find those people within that system. As far as moving students, absolutely, if we have one campus that's the focal point of this incident or this chaotic event, we may have to move students. That may involve large buses. That may involve a litany of ways to move those students and relocate those students. ASU, again, being very large, we do have a rather large transit system. Steve, I just show a thing that says network lost. Can you help me there?
That I think is local to you, so that may mean you will have some trouble moving your slides around. If that turns out to be the case, I can move them for you. It looks like you can still move them, so the network must be bad.
I think. Okay. Very good. Go ahead.
Yeah. Thanks for checking. Now, let's squeeze a few more in. David Nunley wonders, should planning include local agencies such as the Red Cross, local EMO? Do you have a list of local agencies that people should be sure and include in their planning?
Yeah, David, thank you very much for that. And back to those partnership agreements, as I talked about, so we have this EMTrack that we use. We have a system for reunification. But we know that our system is not freestanding and is not the sole source or sole system. So through Red Cross, you have Safe and Well Network. We do partner with Red Cross to come to the table and provide that through many of your social media platforms. So as your public information or your social media components start standing up, Facebook, many of our mass notification systems have check-ins where you can check in and say that you're safe. So that's a component to think about as you're standing up and working on this system, bringing people to the table that know how to query those systems and watch those systems and view those systems to see people that are saying, okay, I'm safe here, this is my location, because that's all part of this reunification process as well. So absolutely, partnership and collaboration are a must because no one system does it all.
One more for this break. Michael Geary wondered, rather than asking for volunteers after an event occurs, do you recommend having a pre-established list of volunteers who've undergone some emergency training? And Anthony responded by saying in Massachusetts, many cities and towns belong to a medical reserve corporation, MRC, and they can be activated by local public health agencies. These are volunteer doctors, nurses, EMTs, etc., that will help out during an emergency. Not sure what other states have, but they can be a resource. So the question is, volunteers before, after, how to organize?
Yeah, absolutely. And Arizona has MRCs as well. And any time that we can train volunteers before the fact and vet those volunteers, especially when we're dealing with minor children, those volunteers have to be vetted. Anytime we can do that beforehand is great, is awesome. However, I think we can all say with almost certainty or with certainty that the people are just going to show up. And it's those people that you need to have a process in place that how are you going to deal with them at that point? Are you going to try to give them on-the-job training and put them in, do you have some roles that are not critical that you can put them into? Are you going to turn them away? I don't know that there's a right or a wrong answer for any of it other than when you're talking about minor children. You just can't let any volunteer around those kids. But anyways, you just have to think through that and have processes in place to deal with that.
Thanks, Alan. We'll let you get back to your presentation with your three-prong approach.
Okay, so let's start talking about this. You know, one of the questions that was posed to me earlier outside of these formal questions talked about working with first responders, campus leaders, and partners, and what was the first step in bringing them together? Naturally, well, the first step is start before the incident happens, and I know that sounds very commonsensical, if that's a word, but that's what start now. Start bringing them to the table, start planning, and start preparing for this situation now. Don't wait until it happens. That's the wrong time to try to get anything in place or anything that's going to work well in place at that time. Okay, I made a statement here that says don't try to eat the entire elephant at one time, and what I mean by that is start with something. Start small. Small meaning find a location on your campus or close to your campus within your community where you can at least start doing a site survey to see if that site would even work as a reunification site for you. One of the things that I meant to touch on earlier was, again, this is before all the FEMA best practices come into place as far as short-term, long-term support sites, reception sites, those kind of things. So this is that first few hours as we talk about reunification. And there's debate out there as to whether or not your reunification, your short-term site is the same as your long-term. And so there's varying views out there on that. That's just going to be whatever happens to work best for you at that time. So start with finding some locations that are ADA compliant. Again, what are your redundancies here? On the Tempe campus, we have a large complex, but if my Tempe campus is the focus of my incident, I may not be able to use that complex. So what are my plans to get students and loved ones and information out to the public as to where my reunification site will be, so that I can have people then divert and go to my downtown, my West Campus, my Polytech campus. Some of you may not have multiple campuses, so you would rely on your jurisdictions around you to help find those sites and that you would go to. Your sites, not only ADA compliant, but they have to allow for separation, sight sound separation of adults and minors. That was a sensitivity question that asked, what are some of the sensitivities towards children? Well, we have to protect them by all means. And again, sight sound separations. You want to pick sites that have the best possible ingress and egress out of those areas. So traffic flow patterns that likely won't be gridlocked and those kind of things. And the other thing is we've gone as far here at ASU to make considerations for what happens when the family flies in and, Phoenix has lots and lots and lots of large events happening. And unfortunately, if this happens during one of those large events, what happens if we don't have rental cars available and stuff? Do we have plans that we can actually go pick up people from the airport? Can we use our faith-based groups that we partner with to provide transportation, those kind of things? So those are all things that you want to think through on these plans as well. Then naturally we want to move to staff training, which kind of addresses one of the earlier questions. And as we start to develop this plan, please, please, please drill your plan as you move along. One of the big mistakes that we've made over the years, and that I've made over the years as the emergency manager or the director of, and is that oftentimes we'd build plans and we'd try to exercise the entire thing at one time, and though we had very valuable lessons learned, I don't know that we just had very valuable lessons learned is the best way to put it. So drill your small parts of your plan because then it will all culminate and build into the bigger portion. So let's move to this three-prong approach, the reunification portion of this. Let me see if I can get this arrow to work. Hey, there we go. So specifically what I'm going to be looking at here is this reunification branch. It is a plug and play. So we have designed this entire three-prong approach process to plug and play under the incident command structure. So under reunification, you would have an emergency call center. Oops, let me get that out of the way. You would have a family reunification center, and you would have a hospital reception site. Okay. If you notice, you have other branches that are part of the incident command structure. You may have a law enforcement branch, you may have a fire and medical, and this branch director would be at the same level as those branches and be able to communicate with those branches. So it looks like I have cut off part of my left-hand slide here, and I apologize for that. Well, let's talk the emergency call center. So ASU is blessed that we have a full-time emergency call center that's staffed by approximately 100 people. 30 or 40 of those are on duty at any time. And so what we have worked on in Arizona, and we're working now with the state and the county, actually, Maricopa County, they're using our system as well, as we worked on a phone number that we would publish in the event of an incident or an emergency, and that would start pointing people to our emergency call center that would start handling these calls. Our sole purpose and thought process there is if we can take things off of the 911 system so that they're not calling our dispatch centers, if we can take the load and the burden off of that system, then this would be a good thing. This emergency call center, as you see, has several units that work within the emergency call center that we would stand up. So we'd have a credentialing unit. So that way when our counselors go to the emergency call center, and that's where we do the actual hospital query, where we use MTRAC, is out of the call center. They have a room, a training room. So we have computers in there, and we would actually bring our counselors into that site and start querying the EM database. They would need to be credentialed. We would want to make sure that they know that they're there or why they're there. This should be data research, a data research unit, which takes us into, that's part of that counseling group that they're digging into that EM system. They're trying to determine where these people may be. Now, this is all started by this call center staff who receives a phone call that says, "Hi, I'm looking for my loved one," and they already have a script in place within their IVR, within their system, that allows them to pull up that questionnaire, and it says, okay, what is your name? What is the person's name you're looking for? Scars, marks, tattoos, clothing, etc. And so then that data that is gained by that call taker is then handed to this credentialing and research unit to start trying to work with. We have this hospital liaison person who then works with the hospitals, communicates back and forth about, okay, we show in the system that you have this patient at your hospital. Is that true? Do you have them? And then we would know where to send the family. Public safety unit or public health unit, call taker unit, family contact, security unit. You can see where all these would have a place. That call center would become a critical point for us, and so we would put a heightened contingency of security over there. For sake of time, I'm going to move through some of these other units rather quickly just so we have time for questions at the end. So if you look at the family reception or reunification, sorry about that, family reunification center, these would be our Sun Fitness complexes that we talk about. So credentialing unit, again, families are showing up. How are we having them sign in? How are we identifying them? How are we badging them so that we know that they're supposed to be there? This whole community is exactly that. Resources from the entire community that can help any of our members that are in need. Our medical unit, this medical unit would help our workers, would help those who have arrived if they have to take medication, they bring medication with them. They flew, they didn't bring that medication with them. We have doctors, clinicians that staff this unit that can help with that type of need as it arises. Behavioral health, our counselors. Back over here at the call center, we also have counselors not only that work in this research area, these areas here, but they also walk the floor because we know that our call takers are going to be maybe in need of clinical services as they get overwhelmed. So that counseling service also helps there. So behavioral health, counseling, child care unit, we've spoken about. Our investigative unit. So think of a major incident, and now you have people around the scene that can't leave the scene, but they may be victims, they may be witnesses, they just can't leave because now their cars or their modes of transportation are taken away, and we need detectives, law enforcement need to talk to them. So this reunification site is somewhere we can take those people and do initial interviews, those kind of things. So we would bring in law enforcement to stand up an investigative unit. Non-governmental organizations, as we talked about, our Red Crosses and all of our partners. The security unit is specifically, we're going to have to lock this site down as we talked about. Reception, check-in, victim coordination. Victim coordination unit really goes in line with how are we helping the people, how are we helping the families through this entire process. One of the things that as a higher educational institution, if we have somebody that's deceased, how do we get them unenrolled from classes? And so we would help with all of that kind of stuff, hopefully in a one-stop shop environment. Spiritual health, that's our clergy, unaccompanied minor unit, volunteers, and medical examiner. Medical examiner, for those of you who don't know, they have a very large and complex questionnaire that they have to do anytime they believe they're dealing with a deceased person and their families. They have a large questionnaire. And then finally, we have this hospital reception site. So once people are arriving at the hospital, we're going to start sending families to those hospitals. And how do the hospitals receive these family members? So this is built off of the HICS, the Hospital Incident Command System model. And so they have reception and badging, child care unit, social services, victims, those kind of things. Now, many of you are going to ask, well, what happens if we send somebody to a hospital and they have an injunction prohibiting harassment from, the person in the hospital doesn't want to see the family members? Well, that's really going to be up to the Hospital Incident Command System, that site, to work with law enforcement to try to determine that. Will we be perfect in that? I guess to say we won't be, but we will definitely try to do the best we can to abide by the wishes of the family members who may or may not want to see loved ones or estranged family members, I guess I should say. So that's our branch organization. Now, where did that guide come from, or where did that list come from, or where can you find that list? Folks, this is probably one of the most important slides here, is for those of you who are trying to figure out, where do I even begin? We've done a lot of the footwork, and if you go to this coyotecampaign.org website, you will find this reunification guide, which has that three-prong approach spelled out in it that I just went over. It's all there for you. It's a very comprehensive guide. You will also find a call center guide. If you're trying to stand up a call center, or you're thinking, what does a call center need to do? There's a guide there. You will find the hospital reception guide that talks about the hospital prong that I just spoke about as well. So go to this site. There's a ton of valuable information there. Naturally, don't forego the FEMA sites that we have. There's good information there as well. This attachments that you see, this comes specifically out of our reunification guide. And so we It's a rather large guide, and it looks voluminous and scary when you first look at it, but don't be afraid. What we've done is we've broken everything down into checklists. So you will have a checklist for the reunification branch director. What is the credentialing unit leader supposed to do? What is the security unit leader supposed to do? And everything has a checklist for it. It's got equipment supply list. It's got situational awareness checklists. So again, those guides are going to be extremely important as you're trying to define your process. Again, I know that we only have an hour. I could speak about this at length for hours and hours and share with you a lot of lessons learned, but otherwise I think we're into our next question answer period here.
Yes, and thanks, Alan. Let's see what we can get in there. First, the slide that was chopped off, I'm going to move back to it here. It looks like that chop off was in the original slides that we received. So any downloads that you all make are going to have the same problem. Alan, maybe if you send us an updated deck, we'll replace the deck that we have on our website that'll be available in a few days with the update, if we think you can do that.
Steve, I'd be glad to, and I apologize for that being cut off. I should have
noticed that. No, I should have noticed that too. So I will absolutely take equal blame. Eileen Robichaud notes that when she goes to, and I'm assuming she's going to the Coyote campaign site, she says the hospital reception site planning guide is under modification and will be posted soon. Any comment on that, or?
Yeah, so they just rewrote it. It was several years since they did the initial, so let me check on that. It should be posted. I know it's been approved, or actually I think they're waiting for one small piece, but it will be posted here in the very near future. Let me check with Deb Robke, who is the administrator of that site, and we'll get that on there.
Okay, I'm going back to the slide with your email address on it so that people can follow up with you. Let's see. So following up on a question from a previous break, Leanne Erdman asks, does your current tracking system have interoperability with other systems, or is it necessary to compile data from other systems and manually input it?
Yeah, it's my understanding that system is, I don't know that it interfaces. I can find that out. I'll reach out to Arizona Department of Health Services, who actually services that system and is the owner of that system. So if I can have that question in an email, if you'll send me that question in an email, that'd be awesome, and I will find an answer for you on that.
Someone wants to confirm that the Coyote campaign website also has the job-specific task books. Is that correct?
So within those guides, if you open the reunification guides, it has all of that within that guide. So that's the job-specific. That's the breakdown in the checklist, if that's what we're talking about. So it would be the next slide that you just went past right there. This one right here comes from those guides, so that is correct.
Buzz Grover wonders, what best practices and policy changes should be put in place in advance of an incident? Is there a resource providing practice outlines that can be presented to upper administrators?
Yeah, so there's a ton of resources out there. FEMA websites has a ton of resources. If you haven't started with anything, start with your basic ICS courses. I would move you towards those, because those are how to manage incidents and how to supervise and manage those type of incidences. Again, there's a lot of resources on best practices for training. I noticed that I had some friends check on this website who offer services in exercise design and control and all of that. So don't reinvent the wheel. Utilize the resources out there, to include myself, and there are a lot of resources out there that can help you down that path. Again, my only caution to you is start small. Don't try to tackle the entire thing, any of this process, at one time, unless you're robust enough and you have enough staff to get that done. Then bless you, and move forward and get that done. But but start small, and that's usually with the conversation with administration about this is a best practice. We need to move towards this, and so get support from your administration, and then move on to site planning, site building, to training, et cetera, et cetera. Your training should always include a component of an after action. What lessons did we learn? And go back and refine your processes based on those lessons learned and what's happening in our country today.
You did say a few words earlier about ADA compliance, and Jean Marie Lawrence asks, how do you incorporate those with access and functional needs? Do you rely on them to identify themselves if and when possible, or do you have a system in place that addresses their specific needs throughout the process?
Yeah, so when we're talking the reunification site specifically, one of the standards that we have brought into play is, and actually we had Red Cross help us with our site surveys so that we made sure that we were compliant, and so that our facilities met all of our needs. And then part of this, as we have developed this over the years, part of our task force, for lack of a better term, our organization that has built these plans, at the table we have groups and individuals that have access and functional needs that can speak on behalf of groups that deal with access and functional needs. So we have them at the table. The other thing that I failed to mention here is a barrier to some of this stuff is our language barriers. And so we've also addressed those through language lines and those kind of things. So we're very open, and we invite anyone to the table that has those type of concerns, and that's how we build our plans, is with that input. With that input, we build our plans, I should say.
Eileen Robichaud, you asked in the hosts area how to send a recording of this to others. Just so that you all know, within a few days, within a week or so, you'll be getting a link to a website that will have the recording of this session, and you can certainly send that link to others. We want as many people as possible to have access to that. Alan, Anthony Marola wonders, is your call center 24/7? And how do you fund it, and who's responsible for training the people in it? And are officers involved? Scott Shepardson wonders.
Yeah, so our call center is 24/7. ASU years ago had outsourced all of our help center, our service desk environment, and we believed, I'm assuming that's why we went back to our own call center. We call it our experience center. So they brought that all back in-house because we didn't feel that we were getting the services that we needed through outside call centers. But it is 24/7. It is staffed. We have the ability to surge our staffing. So say we have 20 to 30 people on the floor handling the calls for service. We have a portion of those that are trained specifically in our reunification process, even if they're not on duty. Because it is, again, 24/7, we can surge. They can come to work from home, so we have that capacity in our call center that they can log on from home and don't necessarily need to come directly in to a physical location. Officers, as far as police officers, no, we use the clinicians. We use the call center staff as our primary call taker, and then our clinicians would integrate into there. Our law enforcement would be used as naturally as a security measure to address any types of needs in those regards. So yes, great question.
Thanks very much, Alan. Thanks to all of our viewers and questioners from around the internet. Check the NCCPS webinars page in the next week or so for a link to the captioned recording of today's presentation, as well as a link to our speaker's slides. The brief evaluation survey I mentioned earlier should already be in your mailbox. It will take you no more than 2 minutes to complete. Please do. We read and act on your comments. The next Campus Public Safety Online is Tuesday, April 16th from 2 to 3 p.m. Eastern Time. The presentation is Adaptive Continuity Planning, What the Industry Can Learn from Case Studies in Higher Education. Our speakers will be Sarah Powell and Emma Stocker, who are the directors of security management at, respectively, Temple University and Portland State University. The registration URL is on your screen and clickable, or surf on over to the National Center webpage at nccpsafety.org. That's nccpsafety.org. Campus Public Safety Online is brought to you by the National Center for Campus Public Safety, with support from the University of Vermont Continuing and Distance Education and the U.S. Department of Justice. Special thanks today to Andrea Young and Dan Cardella. This is Steve Borona. See you next time on Campus Public Safety Online.